What is radiation therapy for Hodgkin lymphoma? Imagine using powerful beams of energy to target and destroy cancer cells in the body. That's what radiation therapy does for Hodgkin lymphoma. It uses high-energy rays like X-rays to attack cancer cells directly. This treatment is often combined with chemotherapy, especially when the disease is confined to one area or when there's a large tumor mass. The goal is to eliminate any remaining cancer cells after chemotherapy or to treat specific areas where lymphoma persists. The radiation is usually delivered from outside the body, using a machine that directs beams precisely at the affected lymph nodes or tumor sites. Each session typically lasts about 15 to 20 minutes, and treatments are usually given 5 days a week over several weeks. To help ensure accurate targeting, small permanent skin marks, often called tattoos, may be placed on the patient's skin. These marks guide the machine to deliver the radiation accurately each time. There are different types of radiation therapy used for Hodgkin lymphoma. The most common is external beam radiation therapy, where X-ray beams are aimed at the cancer from outside the body. A more advanced form is intensity-modulated radiation therapy, which adjusts the strength of the beams to focus more precisely on the cancer while sparing nearby healthy tissues. This is especially helpful when the lymphoma is close to vital organs like the heart or lungs. Radiation therapy is often recommended after chemotherapy, particularly for early-stage Hodgkin lymphoma with bulky disease or residual masses. In some cases, it can be used alone, especially for certain types like nodular lymphocyte-predominant Hodgkin lymphoma. The amount of radiation used varies, generally between 20 and 36 gray, depending on the stage of the disease, how bulky the tumor is, and how well the lymphoma responds to initial treatment. Modern techniques aim to use smaller radiation fields and lower doses to reduce potential long-term side effects. Common side effects include feeling tired, skin irritation at the treatment site, and a temporary drop in blood cell counts. Because radiation can affect nearby organs, long-term risks might include effects on the heart, lungs, or other tissues near the treated area. That's why newer approaches focus on minimizing exposure to healthy tissues. In summary, radiation therapy for Hodgkin lymphoma is a targeted treatment that helps improve cure rates by eradicating residual cancer cells after chemotherapy. It is carefully planned by a team of specialists to balance effectiveness with minimizing side effects. If you or someone you know is considering this treatment, it's important to discuss all benefits and risks with healthcare professionals to find the best approach tailored to individual needs. Always remember that each person's situation is unique, and personalized medical advice is essential.